Hello and welcome. Thank you for joining us today. We are so glad to have you on our team here. Our goal here at McLeod Health Regional Medical Center is to provide excellent quality care. This seminar is a new addition to our new nurse orientation. It has been added to increase your understanding of how we gather data for improvements and measure our quality of care here at MRMC. We hope you leave here today with increased knowledge about the National Database of Nursing Sensitive Quality Indicators. With gaining understanding, we hope you understand the importance of how our policies are set in place to improve quality as an organization. We will briefly glimpse how that data is collected, organized, and used to improve practice. Let's begin. First, let's explain what exactly the National Database of Nursing Sensitive Quality Indicators is. The NDNQI was established by the American Nurses Association in 1998. This is the largest database to track unit-level performance. This data is categorized and allows hospitals to compare themselves to similar organizations on a regional, state, and national level. It provides quarterly and annual reports of structure, process, and outcomes that organizations can use to evaluate themselves, recognize success, and room for improvement. Heb et al. 2023. The ANA also established nursing-sensitive quality indicators. They are specific to nursing and are different than general medical indicators. These were established so the ANA could continue to collect data, and from that data, they could continue their research and further develop nurses' knowledge, evidence-based practice techniques, and any factors that can relate to the quality of nursing care. Ashamari et al. 2023. Evidence-based practice is taught in the nursing school curriculum, and depending on the individual patient's needs and specific organizational policies, there may be some differences in how evidence-based practice and data collection are conducted. Nursing-sensitive quality indicators includes falls with injury, nursing care hours per patient day, skills, pressure ulcer prevalence, hospital-acquired pressure ulcer prevention, and registered nurse job satisfaction. These indicators identify structures of care and care processes that can influence outcomes. Ashimari et al. 2023. Let's move our focus to a specific nursing-sensitive quality indicator. We will discuss patient falls with injury and the associated processes and outcomes. One of the most reported and potentially life-threatening occurrences in a hospital patient is falls with injury. A survey mentioned by Johnson et al. 2020 gives us more tangible number of 3 to 5 falls per 1,000 patient days, which results in approximately 1 million falls annually in hospitals. This requires constant attention, data collection, policy improvements, and education to nurses to ensure we are doing everything to prevent this from occurring. Regardless of multiple fall prevention strategies, falls continue to occur. Falls with injury are a non-reimbursable event for hospitals. Johnson et al. 2020. Patient safety comes first, but the financial implications can be costly for an organizational health. As mentioned above, falls with injuries can be life-threatening. A nurse's primary goal in a hospital is to decrease patient harm and increase quality of care. Falls with injuries negatively affect patient safety and quality of care. As a new nurse, you must be aware of which patients pose a fall risk, how to assess and how often to assess a patient's fall risk status, and the hospital policies and fall prevention strategies. Not only do you need to be aware of them, but you also need to know how to document them so there can be successful data analysis. There are different guidelines for fall prevention, and it's sometimes difficult to effectively identify a successful approach to prevent falls. Johnson et al. 2020. In the event of a fall, with or without injury, it is necessary to know what to do next, who to contact, and how to ensure the patient's safety. Not only is the data and research involving falls with injury important to improve patient care, but the data is also used for future research to continue to identify what patient-specific attributes or specific units have a high risk for falls. Being able to compare results through the NDNQI can be a vital tool in strategy improvement to decrease falls with injuries. As a new nurse, it is essential to recognize that accurate data entry and protocol compliance are vital to ensure proper reporting to the NDNQI. Falls with injuries can be fatal. We want to be successful in implementing our fall prevention strategies and accurate reporting so we can recognize room for improvements to further increase patient safety and quality of care. Nurses are frontline care to these patients. Your diligence in fall prevention can make a difference between the life and death of these patients. Obtaining accurate data is vital to assuring and assessing the nursing sensitive quality indicator. Data reveals if there is an awareness or compliance issue versus an indicator that protocols must be revised because they are ineffective. Protocols are implemented using evidence-based practice, so most of the time it is an issue surrounding nurse awareness or part of the process that was not implemented properly that causes a failure in the system. Regarding falls with injury, let us review the data collection process from start to finish. Frontline nurses, nursing assistants, and interdisciplinary staff are required to complete education surrounding falls. This is either an in-person class, an online module, or a unit-specific training. This is specific to that department and its role in the fall prevention scenario. It is essential to know that fall prevention is a hospital-wide project. The hospital education will have more detailed information for nurses and the role they play. It will review the Hester Davis Fall Program, and examples and details will be given to understand how a patient is determined to fall risk, how and where to chart this in the electronic medical record, and the frequency at which a patient's fall risk is assessed. This education will review fall prevention strategies, some of which every patient receives, and some specific to the fall score obtained from the Hester Davis Fall Scale. Some examples of fall risk strategy includes wristbands, non-slip socks, scheduling, toilet assist, bed and chair alarms, specific signage, patient and family education, and call light usage. Pate et al. 2024. Fall prevention programs are tracked through electronic medical record used for charting. Here at MRMC, we utilize Epic. Epic has routine charting that ensures the patient has a fall band in place, signage is viewable if needed, activation of a bed alarm or chair alarm is non-slip footwear utilized during mobilization, and if patient or family education is completed. The electronic chart will also provide a scale for convenient scoring and be placed to document if the patient confusion is present and their compliance with these fall prevention tools. All falls will result in a post-fall huddle during routine meetings to assess whether it was preventable. The charting in the electronic record is vital. You may not be present for the post-fall huddles, so the charting will reflect if you took the proper measures for prevention, if the patient was confused, or if any other detail may have contributed to the fall. To assist in this data collection, each fall must be reported to the nursing supervisor on duty. She will ask a series of simple questions about staffing and prevention measures. She will also require and improve the process to be done. This gives the nurse a chance for an anonymous, candid response that may not be appropriate for the chart, or the nurse may not feel comfortable reporting to her immediate supervisor about the situation. This information can be beneficial and reveal problems that may otherwise not be present in electronic charting. The clinical nurse manager and supervisor are responsible for collecting data, analyzing, implementing strategies, adjusting protocols, and reporting data to the NDNQI. They perform routine randomized audits to ensure these fall risk assessments are completed and the prevention strategies are implemented appropriately. When audits are done properly, immediate education can be encouraged or timely evaluations can be completed if there's a staffing issue or other patient care needs to be prioritized. The on-unit supervisors can be on the lookout for charting discrepancies, and these audits allow the clinical nurse specialist to obtain information and identify weaknesses within the system. This data is reviewed amongst clinical nurse specialists in different units. They share best practices, review problem areas, and implement new strategies and plans. Staff education positively affects hospital falls, but alarms, sensors, and fall scores do not significantly improve fall reduction. Pate et al. 2024. Constant data analysis, audits, team meetings, and strategic planning are needed to continue to find what works in a specific organization to improve falls. If the data reflects improvement and is reported to the NDNQI, then it can be adapted by other organizations to continue to improve patient safety in their facility. More specifically, in a specific project mentioned in Pate et al. 2024, the audit data was entered into the Hester Fall Sense AI report and data analytics portal. Cumulative data can be viewed and used to measure success and accountability. Compliance was evaluated monthly, and all fall events participated in a post-fall huddle. This huddle involved reviewing elements of fall prevention programs and whether they had been implemented prior to the event. Once the event is reviewed, it is reported to the NDNQI. The clinical nurse specialist can review the NDNQI to assess the organization's standing compared to similar organizations and the data they report. The data collected along with fall statistics are relayed to staff during yearly education. Each year, you will be required to attend a skills fair here at McLeod. All of the clinical nurse specialists organize this event. They use the information obtained from NDNQI to provide information to staff along with any policy updates and review skills. Keep up to date with current evidence-based practice, introduce new products, and rationalize policy changes or new products. It is no secret how important you, as a frontline nurse, are to patient care. It simply would not be possible without you. I also emphasize the importance of accurate reporting and charting. False documentation is a punishable offense. Do not get content with clicking the buttons on the required charting to complete the task. Be mindful of what you are clicking and utilize these reminders to ensure patient safety. Today's seminar emphasized the importance of the collected data and how it can make a difference for patients. Accurate reporting is vital to the safety of our patients and the quality of care. You may not be present for post-fall huddles or any data review to give your version of events. Your charting should be accurate and precise for the benefit of the patient. Thank you so much again, and we are so excited for you to join our team. Please reach out with any questions or concerns.